present today about human rights and pandemic prevention. You can move on to the next slide. So the issue is that in 2021, there was an announcement for an initiative of a new treaty on pandemic preparedness and response. Currently, the treaty is in process of formation, and the first draft has been delivered, but there is a lot of concerns with this draft. And in 2024, the actual treaty is going to be submitted. So the question is, what should a treaty on the prevention of pandemics consider from the standpoint of state human rights obligations, since this first draft has forgotten a few things. Next slide, please. So we're going to mention the incorporation of human rights standards, lack of provisions for equity, inadequate mechanisms for accountability and transparency, needs for stronger commitments and global cooperation, protection, and the protection of a broad range of other rights. You can follow. Some of the rules are Article 2, 11, and 12 from the International Covenant of Social and Cultural Rights. They are related to the highest attainable standard of living and social security and information. Then Article 9 and 19, which are to seek, receive, and impart information, and about the liberty of the person. Then Article 25 of the Universal Declaration of Human Rights, which is also about the standard of living. Then the Syracuse principles of limitation and derogation provisions, which are about how to limit different rights, and the WHO international health regulations.
Now we have the analysis. What could be a good treaty? What should integrate on it? And we have that the respect of the human rights, the duty of positive obligations of the state with the situation of pandemics will be a very, very good treaty, because it will integrate all the elements that we have, the issue and the solution. So all the victims could be in a good solution. Also, this because a treaty that fairly obligates the state to guarantee our human rights in a pandemic situation with all the tools and all the possibilities and all the things that he can do will be perfect to help future victims or possible active victims. Also, the human state must be guaranteed, because in a pandemic situation of the state, some human rights must be prioritized over others because of the situation. Also, this could be the right of health, the right of life, the right of information. And also, I want to give a specific mention to the Article 15 of the International Covenant of Economic and Social and Cultural Rights, because it mentioned that all the state parties of the present covenant recognize the right to everyone to take part in cultural life, to enjoy benefits of science, progression, and applications. And also, on its second paragraph, it mentions that all the people that have developed things must be recognized. Is it?
Okay, so a treaty must take into consideration the human rights when it obligates a state to act. States have obligations under the international health law to prevent and control pandemics. For example, the international health regulations require states to notify the World Health Organization of any event that may constitute a public health emergency of international concern. The international health regulations also require states to take measures to prevent a public health emergency, such as having regulations for passengers at ports of entry and providing travelers with information about a public health emergency. The International Covenant on Economic, Social, and Cultural Rights says that states have a duty to take steps individually through international assistance and cooperation, especially economic and technical, so to achieve the rights of the Covenant. And also, as Clara mentioned before, in Article 12, that it talks about the enjoyment of a mental and physical health. So by having these obligations, that states should take all necessary steps to control pandemics, such as investing in research and development, providing access to essential medicines and vaccines, and ensuring that healthcare systems are well prepared to respond to outbreaks.
Well, it must be ascertained or an integrity of the response of the state in observance of the human rights. It is important that at the beginning, it could be necessary to take actions, but we need a criteria and a clear criteria to follow in an emergency like the pandemics. So there is the need to prevent the discrimination, the unequal access to health service, and respect for the civil, political, and cultural rights of every people in the world and each country.
In this presentation, we talked about what the Treaty on the Prevention of Pandemic should consider from the standpoint of a state's human rights obligation. We talked about the right to health, Article 12 of the Covenant, and this states that the state has an obligation to take measures to prevent, treat, and control a disease. The right to health includes access to, for example, healthcare services, medicines, and information necessary for the disease prevention and treatment. Another important issue was non-discrimination. Measures should be implemented without discrimination based on race, color, gender, age, ethnicity, disability, or any other prohibited grounds. Also, the access for information is very important. To have to provide accurate and timely information to the public about the pandemic, and, for example, preventive measures and the status of the health system. This is important for example, transparent communication. Also, the access to healthcare services is very important. The states should adequate and accessible healthcare services are fundamental to the right to health in the context of, for example, pandemics, ensuring that individual testing, treatment, and crucial. During pandemic, states are obligated to allocate resources effectively and efficiently to address the health needs of the population, and this may include securing medical supplies and ensuring an adequate health workforce.
So now we're going to talk about the positive obligations of the state that have to be taken into consideration when making a treaty. So first of all, what is important is the availability. So states have the duty to ensure the availability of health facilities, goods and services, and this includes the provision of hospital clinics and trained medical personnel. There's also the factor of accessibility. Within this, there's the factor of non-discrimination. So health services must be accessible to everyone without discrimination. And this then involves physical accessibility, which is geographically, information accessibility, and also it should be culturally appropriate, and economic accessibility, which means affordability. And the state needs to provide these measures to be able to have this. And then we have acceptability, which is that measures need to be culturally appropriate and respectful of medical ethics. And then we have progression. So the right to health should always be progressive. It should be improving and innovative, and citizens need to be involved in the policy development, implementation, and monitoring. Next slide, please. And then we go to negative obligations, and then again we talk about discrimination. So the principle of non-discrimination, in this sense, it means that the state should not be involved in discriminating anyone. And then the principle of non-interference, so states must not interfere with the enjoyment of right to health, and this includes refraining from arbitrary interference with the privacy of individuals as well, and confidentiality in medical matters. So in the end, what we're looking at is a multilateral problem that has multiple ways that need to be faced to make a treaty that is good for everyone, and also includes stuff like the rights to food, housing, education, human dignity, etc. And yeah, this is crucial to be considered within the treaty in order to create a treaty that covers all the important bases for it to be beneficial for all citizens. Yeah, next slide, please. Yes, thank you very much.